You probably already heard that cheese is fat. Fat is bad for someone with diabetes, and therefore you should avoid cheese. This chain of reasoning is wrong in at least two of its three links, and science over the last 2 decades has made that very clear. Today I will show you the 7 types of cheese that science has associated with blood sugar control, and why the fat in cheese is not the problem you thought it was. Before the 7 types, the context that changes everything. Cheese has a glycemic index close to 0. That is not an exaggeration, it is physiology. Cheese is composed essentially of protein and fat, with minimal or zero carbohydrates depending on the type and aging time. What this means for someone with diabetes: when you eat cheese, blood glucose does not rise significantly. But cheese does something more interesting than simply not raising glucose. It can reduce the glycemic response of carbohydrates consumed alongside it. Cheese protein, especially whey proteins, casein and whey proteins, stimulates insulin and GLP-1 secretion directly and independently of glucose. This is called the non-glycemic insulinotropic effect. Cheese protein stimulates insulin without needing glucose to do so. When you eat cheese before or with carbohydrates, insulin is already being secreted before the starch is digested into glucose, and this reduces the postprandial glycemic peak in a measurable way. A second mechanism specific to aged fermented cheeses is propionic acid. During cheese aging, lactic acid bacteria produce propionic acid as a metabolic product. Propionic acid activates the GPR41 receptor in intestinal endocrine cells, stimulating PYY and GLP-1 secretion. It inhibits the HMG-C reductase enzyme in the liver, and cell model studies showed it increases expression of genes related to glucose uptake in muscle cells. A third mechanism is vitamin K2, especially the MK7 form produced by bacteria during cheese fermentation, which activates osteocalcin that stimulates insulin secretion by pancreatic beta cells. Type number 1, cottage cheese and fresh cheese. Cottage and fresh cheeses are rich in whey protein, which has the highest documented insulinotropic effect among all protein sources tested in clinical trials. A study in the American Journal of Clinical Nutrition showed that whey protein consumption before a carbohydrate meal reduced the postprandial glucose peak by 21% and increased pre-meal insulin secretion, effect comparable to incretin-class anti-diabetic medications at moderate doses. How to include 2 to 4 tablespoons of cottage before or at the start of a carbohydrate meal, or as protein at breakfast before any bread. Patricia was 65, a retired teacher from Phoenix, who added cottage to breakfast as the initial protein before any carbohydrate. Post-breakfast glucose dropped from 178 to 142 milligrams per deciliter in 6 weeks. Type number 2, ricotta. Ricotta is made from milk whey, the liquid left after casein coagulation in making other cheeses. This means ricotta is exceptionally rich in preformed whey proteins, including beta-lactoglobulin, alpha-lactalbumin, and immunoglobulins. These proteins have very potent insulinotropic effect, greater than casein, and also documented GLP-1 stimulation in the small intestine. A study in nutrition and metabolism showed that whey proteins consumed 30 minutes before a high glycemic meal reduced the glucose peak by 25%. Ricotta is also rich in calcium, necessary for insulin granule exocytosis in pancreatic beta cells. A meta-analysis in diabetes care found inverse correlation between dietary calcium intake and type 2 diabetes risk. 14% risk reduction per additional 300 milligrams of calcium per day. How to include ricotta with berries at breakfast as a pasta sauce base or as afternoon protein. Type number 3, buffalo mozzarella or whole milk mozzarella. Whole mozzarella contains conjugated linoleic acid, CLA, especially when from grass-fed animals, which has documented insulin sensitivity improvement. A review in the Journal of Nutritional Biochemistry analyzed 18 CLA clinical trials and found consistent insulin sensitivity improvement in overweight adults with insulin resistance. Mozzarella fat also delays gastric emptying, reducing the absorption speed of carbohydrates in the same meal. How to include buffalo mozzarella with tomato and basil as a starter before carbohydrate meals. Tell me in the comments where you are watching from right now, and if not yet subscribed, click the button and turn on the bell. Type number 4, aged Gouda or Edam. Aged Gouda is one of the richest sources of vitamin K2 MK7 among all foods, with concentration of 75 to 120 micrograms per 100 grams. Vitamin K2 activates osteocalcin protein that stimulates insulin secretion by pancreatic beta cells. A clinical trial in diabetes care showed that adults with prediabetes who received MK7 supplementation had significant improvement in insulin sensitivity and reduction in fasting glucose after 12 weeks. Aged Gouda provides natural MK7 doses comparable to clinical trials with just 80 grams. Frank was 68, a retired businessman from Cleveland, who included 60 grams of aged Gouda at daily lunch. With baseline HbA1c 7.0, it fell to 6.7 after 16 weeks. Type number 5, aged cheddar. Aged cheddar, matured at least 9 to 12 months, has the highest propionic acid content among common cheeses. A study in the British Journal of Nutrition showed adults who consumed aged cheddar regularly for 12 weeks had 11% reduction in HOMA-IR compared to the control group. Aged cheddar also has very low lactose content, practically zero, safe for lactose-intolerant people. Margaret was 70, a retired nurse from Atlanta, who added a slice of aged cheddar to the afternoon snack. HbA1c dropped from 6.8 to 6.5 after 14 weeks. Type number 6, blue cheese, Gorgonzola, Roquefort, Stilton. Blue cheeses contain bioactive compounds produced by the Penicillium roqueforti fungus, including roquefortine C, identified as an activator of PPAR-alpha and PPAR-gamma receptors in fat and muscle cells. The PPAR-gamma receptor is the exact molecular target of the anti-diabetic medication class called thiazolidinediones, which improve insulin sensitivity in muscle and fat cells. A study in the Journal of Agricultural and Food Chemistry identified Penicillium roqueforti compounds with PPAR receptor agonist activity at concentrations compatible with regular blue cheese consumption. Richard was 67, a retired engineer from Cleveland who included Gorgonzola in salads twice a week. Fasting glucose dropped from 132 to 118 milligrams per deciliter in 10 weeks. Type number 7. Parmesan, or aged Grana Padano. Parmesan has the largest body of direct scientific evidence for glucose metabolism. It has the highest propionic acid content among common cheeses due to its long aging of 12 to 36 months. It is the richest source of vitamin K2 MK7 among hard cheeses. The European cheese paradox. Western European populations with regular consumption of aged cheese have significantly lower type 2 diabetes prevalence than populations with comparable caloric and saturated fat intake but low aged cheese consumption. An analysis of the EPIC study with over 300,000 European participants found 12% type 2 diabetes risk reduction per 30-gram daily increment of aged cheese. Parmesan has the highest histidine concentration among cow's milk cheeses, a precursor to carnosine with documented insulin sensitivity improvement. An Italian clinical trial in Nutrients 2021 with metabolic syndrome adults consuming 30 grams of DOP Parmesan daily for 12 weeks showed 15% reduction in HOMA-IR, 8% reduction in fasting glucose, and insulin sensitivity improvement measured by hyperinsulinemic euglycemic clamp. Patricia grandmother was 72, retired from Atlanta with type 2 diabetes and HbA1c 7.4. After 20 weeks including DOP Parmesan daily, HbA1c dropped to 7.0 and fasting glucose from 148 to 131 milligrams per deciliter. The cheese paradox and saturated fat. Why you were misinformed. The saturated fat inside a cheese matrix, with protein, calcium, vitamin K2, propionic acid, and other bioactive compounds, has different metabolic effects than isolated saturated fat. A meta-analysis in the American Journal of Clinical Nutrition 2018, analyzing 15 prospective cohorts with over 400,000 participants, found no association between whole dairy consumption, including aged cheese, and increased type 2 diabetes risk, and found inverse association between fermented dairy consumption and diabetes. A meta-analysis in the BMJ 2017, analyzing 22 cohort studies with 579,832 participants, found that fermented aged cheese consumption was associated with 8% type 2 diabetes risk reduction per 30-gram daily increment and 6% cardiovascular risk reduction. Fermented cheese was the only dairy subgroup with statistically significant protective association for both conditions. Practical plan for including cheese intelligently in the diet of someone with diabetes. First, always eat cheese before or at the start of the meal, never at the end. Second, prefer aged cheeses, Gouda, cheddar, Parmesan, over processed or melted cheeses. Processed cheeses have bioactive fermentation compounds destroyed by thermal processing. Third, include blue cheese 1 to 2 times per week. Fourth, use fresh cheese as the initial protein at breakfast. Fifth, avoid replacing natural cheese with light or processed versions. Quality matters. Natural cheese versus processed cheese. This distinction is critical. Processed cheese slices have bioactive compounds destroyed, additional sodium from phosphate salts, and sometimes added starch that raises the glycemic index. The practical rule: if the cheese comes in a piece that can be cut and melts naturally when heated, it is likely natural cheese. If it comes in perfectly uniform, individually wrapped slices with a long ingredient list, it is processed cheese. The propionic acid mechanism beyond immediate glycemic control. Propionic acid from cheese has effects that go beyond immediate glucose control. As a short-chain fatty acid, it is a preferential energy substrate for colon cells and has anti-inflammatory effects on the intestinal mucosa, reducing intestinal permeability that in type 2 diabetes is frequently increased and contributes to low-grade systemic inflammation that perpetuates insulin resistance. Recent research in cell metabolism suggests propionate also directly modulates hepatic glucose production through hepatic AMPK activation, the same enzyme activated by metformin. My friend, cheese is not the enemy. The unexamined belief that all fat is equal and that cheese should be avoided by someone with diabetes is the enemy. With the 7 types on this list, you can include cheese with pleasure, intelligence, and scientific evidence on your side. Start tomorrow. A piece of Parmesan or aged Gouda before lunch, and in 8 weeks, compare fasting and postprandial glucose with what it was before. God bless you and give you much health. Until next time. About the synergy of cheese with other diabetes-friendly foods. Cheese does not act in isolation. Its impact on glycemic control is greater when combined strategically. Aged cheese before carbohydrates. The sequence of eating cheese first, then grains or bread, uses the insulinotropic effect of dairy proteins to prepare metabolism before starch arrives. Cheese with low glycemic fruit. The cheese-fruit combination, apple, pear, berries, uses fruit fiber and cheese protein to produce minimal glycemic response. An ideal snack for people with diabetes. Blue cheese in leafy green salads. The bioactive penicillium compounds in a high-fiber context produce the best possible environment for postprandial glycemic control. Why cheese works especially well at breakfast for people with diabetes. Breakfast is the meal with the greatest glycemic variability for most people with diabetes. The dawn phenomenon produces higher glucose in the morning even while fasting, and insulin sensitivity is typically lower in the morning. In this context, the insulinotropic effect of cheese proteins is more valuable than at other times of day. Including cottage, ricotta, or a portion of parmesan before breakfast, bread uses the mechanism of anticipated insulin secretion precisely when it is most needed. Multiple studies with type 2 diabetes adults have shown that adding high-quality dairy protein to breakfast reduces the post-breakfast glycemic peak more efficiently than the same protein added to lunch or dinner, probably because the deficit of anticipated insulin secretion is more pronounced in the morning. The role of vitamin K2 in insulin metabolism, a mechanism most people have never heard. Vitamin K, 2-MK7, is perhaps the least discussed nutrient in diabetes management, yet its mechanism is remarkably specific and well documented. Osteocalcin is a protein produced by bone-forming osteoblast cells. In its inactive, non-carboxylated form, osteocalcin circulates without metabolic effect. When vitamin K2 is present, it activates a carboxylase enzyme that carboxylates osteocalcin, converting it to its active form. Active osteocalcin has two documented metabolic effects. It stimulates insulin secretion by pancreatic beta cells by binding to a specific receptor on those cells, and it improves insulin sensitivity in muscle cells by increasing the expression of glucose transporter GLUT4. This means vitamin K2, abundant in aged hard cheeses, especially Gouda and Parmesan, supports both insulin production and insulin action simultaneously. People with type 2 diabetes typically have lower vitamin K2 status than healthy individuals. Studies show that improving vitamin K2 status through diet or supplementation improves markers of beta cell function. Aged cheese is one of the most bioavailable dietary sources of vitamin K, 2-MK7, the form with the longest half-life and greatest tissue distribution, addressing the saturated fat concern directly. The concern about saturated fat in cheese and cardiovascular risk for people with diabetes is legitimate but nuanced. The most current evidence, including large prospective cohorts and multiple meta-analyses, consistently shows that fermented dairy products, including aged cheese, are not associated with increased cardiovascular risk, and in many analyses are associated with reduced risk. The 2021 American Heart Association Dietary Guidelines acknowledged that the evidence does not support restricting fermented dairy in people without specific medical contraindications. For people with diabetes, the most relevant concern is overall dietary pattern, not individual nutrients in isolation. Including 30 to 40 grams of aged natural cheese as part of a diet rich in vegetables, legumes, and whole grains is entirely compatible with good cardiovascular health while providing the glycemic benefits documented in this video. Monitoring your response: how to use a glucometer to verify the benefits. The most direct and personalized evidence you can gather is your own glucometer data. This test is worth doing. On 2 different days, eat the same carbohydrate-containing meal. On day 1, eat the carbohydrate first, then add cheese at the end. On day 2, eat 30 grams of Parmesan or aged Gouda first, then the same carbohydrate portion. Measure blood glucose before eating and 1 hour and 2 hours after in both cases. The difference in the 1-hour peak, typically 20 to 40 points lower when cheese is eaten first, is direct evidence that the insulinotropic mechanism is working for you specifically. A note on sodium content for people also managing blood pressure. Many people with type 2 diabetes also have hypertension, and cheese sodium is a real consideration. Lowest sodium cheeses: ricotta, cottage, fresh mozzarella. Moderate sodium: Gouda, cheddar, Parmesan. Highest sodium: blue cheeses, processed cheeses. The strategy for people with both conditions: use beneficial cheeses in moderate portions of 20 to 30 grams and compensate by reducing added salt in the rest of the meal. The glycemic and metabolic benefit of 30 grams of Parmesan outweighs the modest sodium risk in that portion for most patients, but this decision should be discussed with your doctor or dietitian. 7 types of cheese, a better relationship with diabetes, and a more enjoyable life with better glycemic control. Natural cheese, not processed, is your metabolic ally. Science has confirmed what European populations have known for centuries. Quality aged fermented cheese is compatible with good metabolic health and may actively support it. Start tomorrow with a piece of Parmesan, Gouda, or Gorgonzola as the first thing you eat at a meal. Your glucometer will confirm what the science already knows. God bless you and give you much health. Until next time. The propionic acid mechanism beyond immediate glycemic control. Propionic acid from aged cheese has effects beyond immediate glucose response. As a short-chain fatty acid, it is a preferred energy substrate for colon cells and has anti-inflammatory effects on the intestinal mucosa, reducing intestinal permeability that in type 2 diabetes is frequently increased and contributes to low-grade systemic inflammation, perpetuating insulin resistance. Recent cell metabolism research suggests propionate directly modulates hepatic glucose production through hepatic AMPK activation, the same enzyme activated by metformin. The propionic acid in 30 to 40 grams of daily aged cheese is modest compared to what fiber fermentation produces in the colon, but the effects are additive and complementary. Eating aged cheese while also consuming high-fiber foods gives you both sources of beneficial propionate simultaneously, a synergy that costs nothing and requires only knowing which foods work together. Summary: cottage and fresh cheese for breakfast protein, ricotta for pre-meal whey loading, whole mozzarella for CLA and fat-mediated gastric slowing, aged Gouda for vitamin K, 2-MK7, aged cheddar for the highest propionate concentration, blue cheese for penicillium, PPAR activators plus propionate, and Parmesan DOP for the full combination with the strongest direct clinical evidence. Natural cheese chosen wisely, consumed strategically, is your metabolic ally, not your enemy. God bless you. The European cheese paradox in numbers. The BMJ 2017 meta-analysis of 22 cohort studies with 579,832 participants found fermented aged cheese associated with 8% type 2 diabetes risk reduction per 30-gram daily increment and 6% cardiovascular risk reduction. That is, the food that seems most likely to cause problems, fatty, caloric, not diabetic food, is in the most robust population evidence associated with lower risk of both most feared conditions. This is what scientists call a paradox only because it contradicts prior assumptions, not because it is biologically implausible. The biological explanation is now clear. Cheese is not just saturated fat. It is a complex fermented food with hundreds of bioactive compounds, propionic acid, vitamin K2, CLA, whey proteins, bioactive peptides, that interact synergistically to produce metabolic effects entirely different from those of isolated saturated fat. This is the difference between nutrient science and whole food science. Cheese in its natural aged fermented form is one of the most mischaracterized foods in the diabetes dietary conversation. With this knowledge, you can make informed, evidence-based choices about cheese in your diet. 7 types, a better relationship with diabetes, a more enjoyable life with better metabolic health. Start tomorrow. God bless you and give you much health. Until next time. Natural aged cheese, not processed, is your metabolic ally, not your enemy.